A marvelous day to all of you. I am Elaine McKinnell, a second year BS Ed Social Studies student from Negros Oriental State University, Shedden Campus. Welcome to Ed 204 Foundation of Special and Inclusive Education. Lesson F Learners with Chronic Illnesses under Unit 3 Typology of Learners with Special Needs. The topic to be covered today's discussion are the following: chronic illnesses, asthma, diabetes, epilepsy, and allergy. And how do we support students with these chronic illnesses? At the end of this discussion, the students will be able to identify the different chronic illnesses affecting learners, like asthma, diabetes, epilepsy, and allergy. Next, describe the symptoms, triggers, and emergency responses for these conditions. Lastly, internalize the importance of creating an inclusive and safe learning environment for students with chronic illnesses. What is chronic illnesses? A chronic illnesses is a long-term health condition that persists over time or develops gradually. A disease or condition or illness is considered chronic if it is lasts for more than 3 months. Chronic illnesses affect approximately to 15 to 10 to 15% of children. Common chronic illnesses in students include asthma, diabetes, epilepsy, and allergy. Addressing the needs of students with chronic illnesses in schools requires a structured, collaborative, and comprehensive approach. Schools can partner with parents, students, healthcare providers, and the community. These partnerships help create a safe and supportive learning environment, ensuring that students with chronic illnesses receive equal educational opportunities alongside with peers. The first common chronic illnesses in students is the asthma. When we say asthma, it is a condition that causes airway inflammation, making breathing difficult. The symptoms of asthma are shortness of breath, wheezing, and coughing, and chest tightness. The asthma triggers when there is a dust, pollen, smoke, or it is cold air, or when you are exercising. To support students who have an asthma, we must allow to use inhaler, ensure a clean environment, provide exercise alternatives, and have an emergency plan. For example of this, when Maria, a 10-year-old student, starts wheezing and coughing during PE class run. She signals her to her teacher who allows her to use an inhaler and rest. Within minutes, she recovers and safely rejoins the activity again. The second common chronic illnesses in students is diabetes. When we say diabetes, it is where the body has trouble regulating blood sugar levels. There are two types of diabetes. The type 1 diabetes is believed to result from an autoimmune response in which the body mistakenly attacks itself, preventing insulin production. It accounts for approximately 5 to 10% of all diabetes. The type 2 diabetes occurs when the body does not use insulin effectively, leading to difficulty in maintaining normal blood sugar levels. Around 90 to 95% of individuals with diabetes have type 2. The symptoms of diabetes are frequent urination, excessive thirst, fatigue, and dizziness. We can protect or support students who have an diabetes. How do we protect? First, allow them blood sugar monitoring, snack breaks, recognize signs of low blood sugar, and ensure medical access. The third common chronic illnesses in students is epilepsy. When we say epilepsy, it is a neurological disorder causing seizures due to abnormal brain activity. Symptoms of this are sudden collapse, jerking movements, staring spills, and confusion. How do we support students who have an epilepsy? First, keep the student safe during the seizures. Do not restrain them. Turn them on their side like this and provide rest afterward. The last common chronic illnesses in students that we have tackled today is the allergy. When we say allergy, it is the immune system reaction to certain substances like allergens. The symptoms of this allergy are sneezing, rashes, swelling, and difficulty of breathing. How do we support students who have an allergy? We must, yes, we must identify and avoid allergens and have an emergency plan. We must educate the classmates of the students who have an allergy. And lastly, act quickly in case of a reaction. In conclusion, students with this kind or common chronic illnesses require awareness and preparedness and support in schools. Teachers should recognize the symptoms of those common chronic illnesses and prevent the triggers and respond to emergencies to create a safe and inclusive learning environment. And that will be all. Thank you.